What brings you in today? What brings you in today?
I've been feeling unwell and I'd like to get checked out. I've been feeling unwell and I'd like to get checked out.
Are you experiencing any pain? Are you experiencing any pain?
Yes, I have a headache and a stomach ache. Yes, I have a headache and a stomach ache.
Do you have any allergies? Do you have any allergies?
Yes, I'm allergic to penicillin. Yes, I'm allergic to penicillin.
Are you currently taking any medication? Are you currently taking any medication?
I'm taking ibuprofen for the pain. I'm taking ibuprofen for the pain.
Have you had any surgeries in the past? Have you had any surgeries in the past?
No, I've never had surgery. No, I've never had surgery.
Do you smoke or drink alcohol? Do you smoke or drink alcohol?
I don't smoke, but I occasionally drink wine. I don't smoke, but I occasionally drink wine.
Is there a history of illness in your family? Is there a history of illness in your family?
My grandmother has diabetes. My grandmother has diabetes.
What is your diet like? What is your diet like?
I try to eat healthy with lots of fruits and vegetables. I try to eat healthy with lots of fruits and vegetables.
How often do you exercise? How often do you exercise?
I go for a run about 3 times a week. I go for a run about 3 times a week.
Can you describe the pain? Can you describe the pain?
It's a sharp pain that comes and goes. It's a sharp pain that comes and goes.
Have you had any recent injuries? Have you had any recent injuries?
No, I haven't injured myself recently. No, I haven't injured myself recently.
Are you experiencing any dizziness or nausea? Are you experiencing any dizziness or nausea?
I feel a little dizzy when I stand up too quickly. I feel a little dizzy when I stand up too quickly.
Do you have any chronic conditions? Do you have any chronic conditions?
I have asthma. I have asthma.
What is your sleep pattern like? What is your sleep pattern like?
I usually get about 8 hours of sleep each night. I usually get about 8 hours of sleep each night.
Have you noticed any changes in your weight? Have you noticed any changes in your weight?
I've lost a few pounds without trying. I've lost a few pounds without trying.
Do you have any trouble breathing? Do you have any trouble breathing?
Sometimes I feel short of breath. Sometimes I feel short of breath.
Have you been feeling more stressed than usual? Have you been feeling more stressed than usual?
Yes. Work has been quite stressful lately. Yes. Work has been quite stressful lately.
Do you have a primary care physician? Do you have a primary care physician?
Yes, I do. Yes, I do.
When was your last physical examination? When was your last physical examination?
About a year ago. About a year ago.
Do you have a fever? Do you have a fever?
I'm not sure, but I feel hot and sweaty. I'm not sure, but I feel hot and sweaty.
Have you traveled outside the country recently? Have you traveled outside the country recently?
No, I haven't traveled recently. No, I haven't traveled recently.
Are you experiencing any chest pain? Are you experiencing any chest pain?
No chest pain, just a headache. No chest pain, just a headache.
Do you have a cough? Do you have a cough?
Yes, and it's been persistent. Yes, and it's been persistent.
Have you been vaccinated for the flu this year? Have you been vaccinated for the flu this year?
Not yet. I was planning to get it soon. Not yet. I was planning to get it soon.
Are you feeling anxious or depressed? Are you feeling anxious or depressed?
I've been feeling a bit down lately. I've been feeling a bit down lately.
Do you have any skin rashes or discolorations? Do you have any skin rashes or discolorations?
There's a rash on my arm that appeared last week. There's a rash on my arm that appeared last week.
Have you had any changes in your vision? Have you had any changes in your vision?
My vision has been blurry at times. My vision has been blurry at times.
Do you have any digestive issues? Do you have any digestive issues?
I've been experiencing heartburn more frequently. I've been experiencing heartburn more frequently.
Are you pregnant or could you be pregnant? Are you pregnant or could you be pregnant?
There's a possibility that I could be pregnant. There's a possibility that I could be pregnant.
How was your sleep? How was your sleep?
I've been having trouble falling asleep. I've been having trouble falling asleep.
Have you had any recent injuries? Have you had any recent injuries?
I sprained my ankle last week. I sprained my ankle last week.
Is there a history of cancer in your family? Is there a history of cancer in your family?
My aunt had breast cancer. My aunt had breast cancer.
Do you have any chronic conditions? Do you have any chronic conditions?
I have high blood pressure. I have high blood pressure.
Do you have any history of mental illness? Do you have any history of mental illness?
I was treated for depression 2 years ago. I was treated for depression 2 years ago.
Do you have any trouble breathing? Do you have any trouble breathing?
I get short of breath when I climb stairs. I get short of breath when I climb stairs.
How much water do you drink daily? How much water do you drink daily?
I drink about 8 glasses a day. I drink about 8 glasses a day. Will this condition be permanent? Will this condition be permanent?
It's too early to tell, but we'll monitor your progress. It's too early to tell, but we'll monitor your progress.
How is this condition treated or managed? How is this condition treated or managed?
We'll start with medication and possibly some lifestyle changes. We'll start with medication and possibly some lifestyle changes.
How often should I take this medication? How often should I take this medication?
Take it as prescribed, usually twice a day. Take it as prescribed, usually twice a day.
Can I drink alcohol with this medication? Can I drink alcohol with this medication?
It's best to avoid alcohol while taking this medication. It's best to avoid alcohol while taking this medication.
What should I do if I miss a dose? What should I do if I miss a dose?
Take the missed dose as soon as you remember, unless it's almost time for your next dose. Take the missed dose as soon as you remember, unless it's almost time for your next dose.
Are there any foods I should avoid? Are there any foods I should avoid?
Yes, avoid grapefruit and high-fat meals with this medication. Yes, avoid grapefruit and high-fat meals with this medication.